My name is Shannon Lloyd, and I'm a Senior Associate for Evidence of Impact with the Clean Cooking Alliance. Thank you for tuning into this presentation on the StoryMap I developed with my colleague, Alicia Oberholzer, on the global impact of household air pollution on health for the Clean Cooking Alliance's Week of Clean Cooking for 2021. We developed the visual storytelling medium to showcase not only the importance of the content, but also the latest secondary data publicly available. Our aim is to have this serve as a resource to both actors in the sector who are looking to harness these data, but also to actors who may be outside or adjacent to the clean cooking sector, looking to learn more and how to help. Following this presentation, you as a participant will be able to use and share this resource with others. Details on where to find and access this story map will be addressed at the end. Finally, as I go through the story map, I will be discussing the content as well as the functionality in each section. With that, here is Hearths and Health, evidence of the global impact of household air pollution on health. We know that globally, exposure to household air pollution, or HAP, from cooking with solid fuels and kerosene over open and inefficient fires contributes to up to 4 million deaths per year. HAP is also not confined to only the home. Toxic pollutants escape from the home and contribute to poor air quality as well as the climate crisis. You'll notice that as I scroll through the story map, the bar header will change to show what section you are in. You can also click directly on these sections and it will take you right there. Here we dive into this context more to set up the importance of this topic. PM2.5 is a commonly measured pollutant by scientists when examining the health impact of household air pollution. In order to contextualize PM2.5 levels for cooking, we can look at the WHO guidelines. The WHO recommends annual mean PM2.5 concentrations of less than 35 micrograms per cubic meter of air. We know that wildfires, for example, far exceed the WHO guidelines. This number on the left comes from the average PM2.5 levels during the height of the 2020 wildfires in Yosemite National Park in the US. As you can see, typical concentrations of PM2.5 in kitchens far exceed even wildfire concentrations. Continuing on, a number of negative health outcomes from PM2.5 exposure can be explored here. For all interactive figures in the story map, you'll need to click to interact, and then you can click to explore. So you can see impacts to eyes, respiratory, cardiovascular, lungs, skin, as well as neonatal impacts. So now that we have framed the content, we can begin to explore the data and the story map's functionality. Since HAP is not only confined to the home, it contributes to poor air quality in both urban and rural areas. These maps show the percentage of ambient air pollution measured in PM2.5 that comes from the burning of residential biomass in each country. These data come from McDuffie et al. 2021, and there's a reference list at the end of this webpage so you can locate the data if needed. The interesting part about story maps is being able to walk through the audience through the story. For example, here we discussed that the residential burning of biomass accounted for over 15% of ambient PM2.5 in 2019. Then we can highlight a certain area, like here in the case of Nepal, where the percentage of residential burning of biomass exceeds 30%. Finally, and I set up every map this way, at the end of the narrative content, you as the user can interact on your own. So first, you'll go to the map. Again, you'll need to click to interact. You can see a legend at the bottom left-hand side of the screen. And you can zoom in and out by using the plus minus buttons on the right-hand side or by clicking Enable Map Scroll and then scrolling with your mouse in and out. And you can also hover over countries or click directly on them to see the data points, as well as dragging around the map. So for this map, you'll see data for 3 points, and this is an example of what it will look like when we have data for all 3 points, and an example of what it looks like when we do not have the data. The next section follows a similar setup to the previous one, focusing on the death rate attributable to HAP in number of deaths per 100,000. Again, clicking on the map, and then you're able to drag and explore the map on your own. The next two sections have interactive figures rather than maps. First, we discuss the number of HAP-related deaths by cause. And then scrolling down to the interactive figure, similar to the maps, you click to interact, and then you can see the numbers associated with each slice of the pie chart. In this case, the number and percentage associated with the death, for which the data come from the IHME's Global Burden of Disease Study for 2019. Next, we outline that children under 5 are a particularly vulnerable population to HAP, negative related health outcomes. This section also has links to the reference studies and sources denoted by these dotted underlines. So if you click on one, it'll take you to a new tab with the source where you can read more about it. And this interactive figure will then show you the percentage and total of children under 5 deaths caused by lower respiratory infections attributed to HAP in 2019. The next section on policy actions, we represent the number of policies around the world that are cooking related, and of those policies, if any, mention health impacts. Navigating to the map, here are a few of those examples. Where there are no cooking related policies in place, where there are cooking related policies in place, but none mention health impacts, and where there are cooking related policies in place, and at least one of those policies mention health impacts. Finally, we highlight the importance of increasing access to cleaner cooking solutions, the need for further investment in the sector, and the number of people relying on polluting cooking fuels and technologies over the last 10 years. As well as we direct people to our #CleanCookingIs campaign and CCA's website and newsletter, followed by all of our references as they appear in the story. So finally, how can you access the StoryMap and share it with other users? You can either take a picture of this QR code or scan it now, or you can Google the Week of Clean Cooking and navigate to our events webpage. Here, you'll see a pane like this on the left where you can click on Activities and Engagement and visit the StoryMap. This StoryMap is best viewed on a desktop or laptop computer rather than a smaller screen like a smartphone. If there are any questions that come up while interacting with this resource, you can contact me directly at sloyd@cleancooking.org. Thank you for your time, and I hope that this serves as a useful tool for you in the future.